Vaccine can't come soon enough for hard-hit states, including Arkansas. More than 1,000 people are hospitalized with COVID there right now. That's up nearly 65% over the last 4 weeks. The death count is climbing, sadly, too. Nearly a quarter of all the state's COVID deaths recorded in the month of November. And it's getting worse. Governor Asa Hutchinson now. Governor, thank you.
Sure. Glad to be with you.
The headline in the Democrat Gazette is of hospitalizations at a new high for a third straight day. Some hospitals in your state are considering putting 2 patients in 1 ICU room to save space. You just rolled out a new hospital coordination plan. That'll take at least 2 weeks to put in place. How concerned are you that 2 weeks will be too late?
Well, I think we have some still capacity that we could utilize, and I've got a great task force of hospital administrators, of nursing home administrators that are looking at our hospital space and how we can manage it better, both on the front end, which is better utilization of therapeutics outside of the hospital setting, but then also looking toward on the tail end of it to be able to move even non-COVID patients out of the acute setting in the hospital to another setting. And we're trying to make sure that we're managing all of that well. But you're right, the key is that we manage our hospital space in a way that gets us to the vaccine, that gives us the greatest hope around the corner. That's the best news. December is a key month for us that we get through this. And that's what we're working hard every day. And I applaud our healthcare workers that are doing a tremendous job managing the crowded space that's getting more challenging in the hospitals.
Governor, you've said that lockdown is the last thing you want to do. So in the absence of that, how do you slow the spread?
Well, we're continuing to look at different measures. I mean, I've put a curfew on our bars and restaurants, trying to limit some of those gatherings that we can regulate. Now, most of it is in the home environment. Most of it is in the social environment that you really can't deal with very well. But where we can have a targeted approach, we want to be able to do that. But in addition, our Kansans are working very hard, and the report card's not in yet over Thanksgiving. We'll know in a couple of weeks. But everybody adjusted their Thanksgiving. They had smaller groups.
I wish everybody
they had their
had.
social distancing. So I hope that works as we see those results in the coming days.
Your Secretary of Health, Governor, is the chairman of the committee that met on vaccine distribution today. And he said a vaccine could be available in your state in the next couple of weeks. Is Arkansas ready for that distribution, or do you still need and would you request more federal help?
We're ready for the distribution, and I applaud the federal help already that is really covering the cost of the direct distribution of the vaccines to the hospital or to the provider. We're managing that flow. The cost primarily is following and being paid by the federal government. Now, are we ready? Yes, we've submitted our plan. We're going to have to do some adjustments to it because we don't know exactly the volume of vaccines we're going to get in the first round, and it's clearly not going to be enough to cover our hospital workers and our nursing home staff and residents. And so we're going to have to do some fine-tuning to make sure it's used wisely and fairly and gets to the people in the greatest need. Obviously, our healthcare workers, to me, is the right call, and I appreciate the recommendation of the CDC Advisory Committee.
Governor Hutchinson, all the best to you and Arkansans. Appreciate your time.
Thank you. Great to be with you, Shep.
Shepard Smith here. Thanks for watching CNBC on YouTube.